In this episode of Ask Me Anything, I got a great question from the internets from a massage therapist that asked, what do you do or how do you handle when a client blames you for making their problem worse after treatment? Everybody, Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthier and help more people. One of those interesting questions, and I've had this happen to me a lot over the years, and I recently just had this happen as well, where a client, that's been seeing me now for probably like a year, finally got an MRI done and then came in with their MRI and showed me the MRI and then basically told me, look what you did to me from your treatments. My discs are blown out and look what you did. And I was kind of like dumbfounded when that happened. And I was like, oh, what I did to you. And just a little background on this client. They're very unhealthy. Some would label them as overweight. They definitely smoke. They don't exercise and they eat like garbage or shit. So yeah, they want to blame you. And in Humans, and one of my favorite books of all time, I talk about it all the time. If you haven't read it yet, it's a giant book, but it's the best book ever on dealing with human nature, the laws of human nature. It talked about these different types of biases that we have as humans. And one of the worst ones we have is what's called blame bias. So essentially, there's 3 layers of blame when it comes to humans. Number one is they start to blame the circumstances. So when someone blames the circumstances, they might say, well, it's my weight, it's my genetics, I don't have time for this, it's my job, something like that. And they start to blame the circumstances. Then they start to go a little bit deeper. Then they start to blame other people. Well, it's my husband's fault because he doesn't eat right and then I eat like crap. It's my kid's fault because they're always busy. It's my mom's fault because she never taught me any good things. And they start to do that more and more. And then lastly, when you really evolve as a human, you start to blame yourself and understand and taking radical responsibility for your lot in life and where you are. Most people never really ascend to that level. And when they do, it's usually kind of like bullshit where they're just like, well, it is my fault, but what am I going to do? Woe is me. They get stuck in that victim just mentality, and you don't want to be a victim. So basically what I end up seeing is that most people are stuck back and forth between number 1 and number 2, blaming circumstances and blaming other people. This is what this client did with me, blamed me, because it's a lot easier to blame someone else for your poor health and say that my treatments did all this damage and not really taking responsibility that you're unhealthy, you don't take care of yourself, you don't exercise, you don't move, you don't eat right, all those things. And those are hard. And that makes you look internally. And it's hard for people to look internally because it's a tough place to go. There's some dark stuff in there. So it's a lot easier to blame someone on an external level. So you have to understand what your role is as the practitioner. You're there to help. You're there to help. That's it. You're there to help. I always give this example of, it's kind of like they need to climb up a mountain and they come to you and say, hey, I'm going to jump on your back and you carry me up. It's like, no, I'm going to help you along the way, but I'm sure as hell not carrying your ass up the mountain. And a lot of, I guess, in the treatment world, and this is why I think like things like pain pills, injections, and surgeries are so rampant, and why people do it is because it doesn't require any effort on the client's part. They basically come in and say, here's the fire I started, you put it out. It's like, no, I'm here to help. So what do you do when this happens? Because I'm sure it happens. When this happened to me, I've seen it so many times. I realized what to do. Number one is like right in the moment, I just stopped everything and I slowed down and I got calm. What I end up doing is I actually sat down. Like the client was sitting and I was standing. I sat down and got eye to eye with them. And I got real calm because what's happening is this person's being really emotional, and you got to be logical with them, because if you try to fight emotion with emotion, it's not going to work. It's not going to win, and you're going to be in a bad place. So I calmed down. I didn't take it personal. They're blaming me. I understand it's not me. It's not anything that I did. It's their own shit. But here we go. I got to I got to confront it. I can't just ignore it. So what I've also learned is start to show more empathy and less sympathy. You know, there's a big difference there. Like empathy is where you like understand what they're going through, but also understand that like you can't feel sorry for that person. And so many of us have like this sympathy where we feel so sorry for them, and we're like, oh, that sucks for you. Yeah, it does suck. There's a lot of shitty things that happen to people in life that are really messed up, but that's life. And if you get there and you show them more sympathy, it actually allows them to perpetuate more of that bias and more of that victimhood mentality. So what's the problem really going on here? Number one is just a lack of personal responsibility for people. We've seen this in society. Victimhood is applauded. You know, you're actually celebrated for being a victim, and we never used to be like that. We used to feel bad for victims and be like, yeah, that sucks that happened to you. But now it's like their badge of honor. Like, oh, this happened to me and this is my life and I'm not going to change anything. It's like, well, that's how you're going to be. Like one bad thing happened and you're going to just live in that forever. Like that's a real mess up way to go. Number two that I end up seeing on the practitioner's part is just poor communication and just education on your own part, you know, explaining to the client, like, they're doing too much. Like the biggest thing that I end up dealing with clients is this idea of like load management and capacity. So if you look at it like a teeter-totter, on one side is load, what they do, capacity is the other side is what they can take. When you're injured, your load exceeds your capacity. So our job as a practitioner is to fix their capacity so they can do more load. But inherently what happens with clients are they continue to do more load and then their capacity doesn't get any better. I always give this analogy. I'm really big on analogies, especially with like dental analogies. I'm like, can you imagine going to the dentist, getting a cavity and then leaving and then not brushing your teeth, not flossing, eating a bunch of candy, and then going back to the dentist and bitching and complaining that you still have a cavity? They'd be like, well, look what you're doing. It's the same thing with load. You just have to have that conversation with people because at the end of the day, they're just doing too much and you're not a miracle worker. And if you're fixing all their capacity, then they go and do a bunch of load, it's not going to get you anywhere. So really dialing in with that communication and educating them that they have to do their part. They have to participate in treatment. It isn't a passive thing where they can come in once a week, lay down on the table, then go do a bunch of dumb shit in between and not get any better. They have to participate. Number three, just too much treatment. You're just doing too much treatment. You know, I call it the kitchen sink approach. You know, you're beating the hell out of them. You're doing deep work, cupping, stretching, myofascial release, throwing some tape on it, doing some corrective stuff, and you're just doing too much. Treatment is like a medication. You want to get just enough to be right. So a medication can be effective, but it can actually be overly effective if you do it. And so many practitioners are on the other end of that where they're doing too much and it doesn't allow the body to heal up. This is why I advocate for a shorter, more effective treatment time, because if you're doing too much, they're never going to really be able to heal. What I advocate for is like, let's get them 5 to 7% better over a series of visits instead of trying to get them like 30 or 40%, which is going to be way over effective and cause a lot of issues. So how do I solve this in my own clinic? Number one is I have accountability. We have everyone sign a code of conduct. Code of conduct is like, hey, you got to show up on time for your appointments. We have them pay for all their appointments in advance. You can't do stupid shit in between. You got to clear it with me if you're going to go see another practitioner. Just really understanding that like you can't do all this extra stuff. If they're like, well, I want to go run a marathon. And I'm like, well, your knee can only handle like 2 miles. They're like, well, I'm going to do that anyway. So then what happens is I keep their money and they get a strike and then they don't get treated by me. Number two is learning to cultivate empathy. It's hard, but one thing that I really like to do and like I like to share is this idea of asking the question of the client as I go through the history of how is this problem affecting your quality of life? Like really listening and understanding, like everyone deals with it in a different way. And if you can really show them that you care and you're understanding, they're going to connect with you a lot better. Number three, quit wailing on people. You're just doing too much treatment. You know you're doing too much treatment. Just put it down a little bit. Do a little less. Be on the safer side of the medication, not on the other end. And number four is just focus on objective data. So what is objective data? Objective data is real data, like not just like, hey, how do you feel? It's real data. Like what is it? We do tests, we do functional tests, we do strength tests, we do all that kind of stuff. Having real data, photos, pictures, videos, showing them real data so that they can't just be like, well, it still hurts, because so many people focus on subjective data like, hey, how do you feel? And that's very emotional. And when you go down that emotional route, you're going to be chasing it where sometimes they feel really good, sometimes they feel really bad, but they're going to always equate it to what you did for treatment, not all the dumb shit that they did in between. So thank you so much for sending that question in, and hopefully that this video helps. If you like the video, give it a comment, like, or share. If you haven't got our free training yet, we go into that a lot about the ideas of asking the right questions, educating clients properly, and understanding that you are a helper, but you're not the one doing all the work. Share with other practitioners that you know this might help. And lastly, just send us any questions you might want me to cover. I love doing these, and I always appreciate everything. And I will see you guys on the next one. Bye.